Good day everyone, my name is Eileen Grace T. Danyan from BSN 111D. So now I'll be assessing the abdomen. Prior to conduct the assessment, review the medical records of the patient and for the doctor's order sheet if available. This is to know what assessment to do in the patient. Determine the scope of the assessment to know what equipment to use and also prepare for the necessary equipment such as stethoscope, marker, and also the tape measure. Perform hand hygiene to prevent microorganisms and don gloves if necessary. Good morning, ma'am. My name is Eileen Grace T. Danyan from BSN 111D. May I see your wristband, ma'am?
Yes.
Please state your complete name, ma'am, and also your birth date, please.
Lorena Sereno, December 6, 1970.
Okay, thank you, ma'am. How would you like me to call you, ma'am?
Lorena.
Okay, ma'am Lorena, I'm going to assess your abdomen to check if there is any abnormalities of it. And also, Lorena, I'm going to ask you to sit, to side in the other side, and also to stand up. Is it okay to you, ma'am?
Yes.
Okay. So, do you have any questions, clarifications?
No.
Okay. So, as you can see, ma'am, I'm done closing the door and also the window so that no one in the outside will disturb us while we were doing the assessment. Okay?
Yes.
Ensure that the bladder of the patient is empty. This is to eliminate the distension and also the interference with an accurate examination. Position the client in a supine position and cover the upper and lower body parts of the patient with a bed sheet and leave the abdomen exposed. This is to easy access, or this is to have the easy access of the abdomen. Note for any vascularities in the normal findings, scattered fine veins may be visible. And also note for the stretch mark, old silvery or white stray mark from the past pregnancies. Note for the lesions, rashes, or the scars. Scattered scar should be alert for the possible internal adhesions and also check for the size and colors. Note for any scars and document it by its quadrants and the reference lines. Inspect for the umbilicus of it. Check for the color, contour, and also the location. Bluish discoloration around the umbilicus indicates intradermal abdominal bleeding. While the client lies in a supine position, sit beside the client and look across the abdomen for checking for the contour of the abdomen if it is flat, round, or distended. Inspect the area in between of the lower rib and the pubic bone and note for any abdominal enlargement. Measure the girth using the tape measure and also at the same time, ideally in the morning. This is to evaluate the abdominal distension of the patient. Ensure that the bladder of the patient is empty. This is to eliminate the distension and also the interference with an accurate examination. Place the patient in the supine position and use a disposable, easily clean the tape measure. If the tape measure is not available, use a strip cloth with gauze, then measure the gauze with the cloth tape measure or the yardstick. Take the full measurement at the same location and mark it in a bold point, and also ask the client not to wash the mark until it is not longer needed. So now, ma'am, I'm going to measure your abdominal girth. Mom, do not wash the mark, mom, if it is no longer needed, okay? Check for the symmetry. Ask the client to raise his or her head for the further assessment of the herniation. Inspect for the abdominal movement if the client breathes. And also observe for the peristaltic waves. Peristaltic waves is generating by the neuromuscular action are the main mechanisms in the ureter, transport in the urine, transport in the ureter. Mom, can you raise your head? And can you breathe? Mom, inhale and exhale. Okay, thank you. Use the diaphragm. Use the stethoscope of the diaphragm and make sure that the diaphragm is warm before placing it to the abdomen. This is to assist the patient tension. Apply a light pressure or simple rest of the stethoscope if the abdomen is painful or tender. Bowel sound will be more active over the lexical in the right lower quadrant. Perform the auscultation starting with the right lower quadrant, then clockwise. Bowel sounds will be more active over the invisible valve with the right lower quadrant. And listen for each quadrant for the maximum of 5 minutes, 1 minute for the minimum per quadrant to confirm for any absence of the bowel sounds. Bowel sounds occur every 5 to 15 seconds. And note for the intensity, frequency, and also for the pitch of the sound. Use the bell of the stethoscope to listen for the bruits. And also auscultate for the venous hum. Use the bell of the stethoscope to listen for the venous hum in the epigastric and umbilicus areas. Auscultating for the vascular sound is especially important if the patient has hypertension. Russian hand technique, lightly and systematically Determine the lower border by percussing beginning from the right lower quadrant at the mid-clavicular line, then upwards. Note for any change of the tympani. It signifies a change from the fluid to air. And also mark the dullness of the liver. The liver dullness usually heard at the costal margin. Locate the liver border of dullness. Ask the client to take a deep breath and observe for the descent of the lower border of liver dullness and percuss it and ask the client to exhale afterwards. Mom, can you take a deep breath, Mom, for me and hold for it, Mom, because I'm gonna be percussing it for the liver of dullness, okay, and exhale afterwards. Okay, Mom, can you take a deep breath? Okay, you can exhale, Mom. Locate the upper right chest at the mid-clavicular line and percuss it downward. Mark the upper right chest until the liver of dullness is noted. Measure the two distance of the marks. So this is the liver span. This is to determine the size and also for the identifier for the possible hepatomegaly. And repeat the percussion of the liver at the mid-sternal line. Begin the percussion on the posterior to the left mid-axillary line and percuss downward. Note for any change of the lung resonance to the splenic dullness. The spleen is an oval area of dullness. Perform the second method by percussion of the percussion by asking the client to take a deep breath and then percuss it. Mom, can you take a deep breath, Mom? Okay, you can exhale. Blunt percussion of the liver. This is to measure the liver of the size and also to assess the tenderness. Ask the client to sit his or her back to you. Place the left fist against the lower rib cage and use the ulnar of the right fist to strike the left fist. And also note for the tenderness upon percussion. Mom, can you sit? Ask the client, blunt percussion of the kidneys. This is to assess this is to help to assess for the tenderness. Ask the client to sit his or her back to you. So my client is already sitting back to me. and place the left hand to the controvertebral angle and repeat the step of 44 and 45. Percast the flanks from the bed upward toward the umbilicus area and note for any change of the tympani, of the dullness of the tympani. Assist the client to turn onto the side. Percast the abdomen from the bed upward and mark the level where the dullness changes to tympani. Perform the fluid web test. This is to assist or this is to know if there is any fluid movement in the abdomen. Ask the client to place his or her or ask the client to place the ulnar side of his or her hand at the lateral side of the forearm firmly and firmly place the palmar surface of the fingers and use the other side of the hand to tap the abdominal wall and note for any fluid movement. So ma'am, can you place your hand? Position the client back in the supine position. Cover the upper and lower body parts with a bed sheet and leave the abdomen exposed. And begin to palpate on a non-tender in the abdominal quadrant. And also use a fingertips to compress. Lift fingers gently and proceed to the next quadrant. Begin palpating all the quadrants. Use the palmar surface of the fingers to compress all the quadrants to a maximum of a depth 5 to 6 centimeter. This is to delineate the abdominal organs and muscles. Note for any resistance and perform by manual palpation if the different structures is felt. Palpate for muscles. Use fingertips to compress all quadrants to a depth of 1 cm in dipping motion. Note for any muscles and also for the size, consistency, tenderness, pulsatility, and for others to avoid quick jabs. Palpate the umbilicus and its surrounding. Note for any swelling, bulges, and muscles. Palpate for the aorta. To assess for the abdominal aortic pulsation, which may indicate for the possible aortic aneurysm. Use your thumb and fingers or use your both hands to palpate deeply and assess for the pulsations. Palpate the liver and note for the consistency and tenderness. Stand at the right side of the patient and place the left hand under the client's back at 11 and 12 ribs. Lay the right hand parallel to the right costal margin. Ask the client to inhale and compress inward and upward deeply and note for the consistency and tenderness. Ma'am, can you inhale? Stand at the right chest of the patient. Curl the fingers of both hands and ask the patient to take a deep breath and note for the tenderness and consistency. Ma'am, can you take a deep breath, ma'am? Test for the cholecystititis. It is a redness and swelling of gallbladder. Press the fingertips under the liver border and note for the right upper quadrant pain. Palpate the spleen. The spleen is seldom palpable of the left costal margin. Stand at the right side. Reach over the abdomen. Reach over the abdomen with the left arm. Place the right hand below the left costal margin. Ask the client to inhale and press inward and upward and note for the consistency and tenderness. Ma'am, can you inhale? Ask the client to turn onto his or her side and palpate the spleen by moving it downward and forward. And document the size in centimeters and note for the consistency and tenderness. Ma'am, can you turn this side now? Palpate the kidney to know if the kidneys is non-painful. Place the left hand on the right posterior flank. Place the right hand upper to the right quadrant. Ask the client to exhale and hold the breath briefly. And also gradually release the pressure to the right hand. And repeat the step to the left kidney. Ma'am, can you exhale and hold for your breath for a bit? Exhale, ma'am. Hold. Diretso, ma'am. Exhale and hold for a bit. Begin palpating on the symphysis pubis and move upward and outward and note for the consistency and tenderness. Perform hypersensitivity test. Visceral hyperglasia is an increase of sensitivity of the pain. Grab a fold of your skin and your index fingers and let it go. And repeat for the 102 steps for the several times and note for the pain and skin reaction. So a sign. It is a medically sign that indicates to the irritation of the ellipsis group to hip flexors of the abdomen. So ask the client to lie on the left side and hyperextended the right leg of the client and note for the pain and reaction of the patient. So ma'am, can you lie on the left side? Ma'am? Test for the obturator sign. It is a physical test of inflammation in the group of or in the region of the obturator in the internus muscle. Hold in support the right knee and ankle of the patient. And also, flex the hip and knee and rotate the leg externally and internally. And also, note for the pain and the reaction of the patient. Test for the appendicitis. Appendicitis can cause serious complication. Assess for the rebounds tenderness by palpating deeply at 90 degrees. Suddenly release the pressure, listen and watch the patient expression in pain, and also ask the client if where is the most painful, if it is pressing or it is in the releasing. And ask the client where in the abdomen is the pain occurred. Ma'am, do you feel pain, ma'am? No. So I'm done helping the clients to put her clothes back and the client is comfortably positioned in the bed. So ma'am, here's the summary that I've gathered when we were doing the assessment earlier. So when I assess your vascularity, scattered fine veins may be visible. There's no stray and also you don't have any scars in your abdomen. The abdomen is free from lesion and rashes. The umbilical skin stones are similar to the surrounding umbilical skin tone. Umbilicus is midline at lateral line. When I assessing the contour of the umbilicus, it is recessed and or protruding no more than 0.5 cm. The abdomen is flat and also it is symmetric and does not have any bulges when you raises your head. Abdominal respiratory movement may be seen. A light pulsation of the abdominal aorta which is visible in the epigastrum. Normally peristaltic waves are not seen. Breath are not normally heard over the abdominal areas. Normal dullness is heard over the liver and spleen. The lower border of liver dullness is beaded area of dullness approximately of 7 cm wide near the left 10th rib and lightly posterior in the mid-axillary line. Normal tympany is heard at the last left interface. No tenderness in performing the blunt of liver and also the kidney. Abdomen is non-tender and soft. No palpable masses are present. The tests for the ascites, appendicitis, and cholecystitis are negative. So, when I assess your abdomen, ma'am, there is no abnormalities of it and everything is normal, ma'am. And I advise you, ma'am, to to keep your abdomen healthy, mom, and also um, eat eat vegetables, and also you have a balanced diet and keep it, mom. So you have a healthy body, mom. Thank you so much, mom, for your time, and have a nice day ahead, and God bless you all.